Hello, my name is Bill Behan. I'm the Director of Nursing here at CHR.
Hi, I'm Courtney Sheehan, licensed professional counselor and one of the senior program directors here at CHR. Today we're going to talk about diabetes and how it impacts the people we care for at CHR. Bill, can you break down diabetes a little bit so we can understand it?
Sure. I think the more you read about diabetes, the more confusing it may get. But basically what diabetes is a person's body's decreased ability to process sugars or carbohydrates and turn those into energy in our cells, right? So what happens then is the sugars will build up in the bloodstream, okay, and not a healthy thing to have happen, and not get to the cells of our body to provide us with energy and, movement and all those things that our bodies do with the nutrients that we have.
So I think it's also important to highlight that our blood sugars, fair to say, have a pretty significant impact on our mood and our thinking. And so when those things are out of line, we're going to see things like changes in mental status. So that's someone's ability, concentration, and their thinking, their memory, perhaps. We also know that people managing diabetes, up to half of all folks with diabetes, have some incidence or experience with higher rates of depression,
Sure,
anxiety, disordered eating, and the changes in mental status that I mentioned.
Sure. So a couple of things on that, right? Both a high blood sugar level and a low blood sugar level can affect someone's mood and anyone's mood, not necessarily just somebody living with mental illness. If anybody has experienced the phrase is hangry, when you get a little too hungry, your blood sugar starts to go down, we all get a touch crabby, right? All feel a little disorganized, right? And certainly when our blood sugar is too high, that can affect us in our body's motor control, our ability to process information and make decisions, can definitely change someone's affect. If someone's blood sugar is very high, they may appear that they're almost intoxicated, but it's really their blood sugar. And in terms of, the long-term effects on mental health for somebody with diabetes, sure. I think that there's a couple of things to remember. Diabetes is a chronic disease, and all chronic diseases affect an individual's mental status. It's not a fun ride, right?
Good point.
And I think that, as our blood sugars go up and down, that affects us. So when you think of somebody already living with a mental health condition that affects their affect, and now we have a second thing influencing their affect, not just their bipolar disorder, for example, but now we've got bipolar disorder and blood sugar affecting things.
It's such a good point, right? Because what we know is that treating behavioral health conditions and substance abuse conditions at CHR, we also know that that population is a higher risk of diabetes for a multitude of factors. So it's good to be talking it out. We also know that some groups are impacted. We know that Asian Indian communities, Hispanic communities, African American communities have higher incidences of diabetes. So it's important that care is culturally centered, that we are providing care for whole person care in linguistically friendly environments, culturally informed environments, providing healthcare professionals that may represent their communities. Things like that can go a long way.
And tailoring our interventions and our teaching to appropriate cultural beliefs. I think of one perfect example. For those of us who work in the Manchester office, we see a lot of Latinos, right? And, some of the dietary stuff there is more carbohydrate focused, rice and beans, those kinds of things. So we need to be mindful of who somebody is while we're telling them about what their diet needs to look like, okay? Because food isn't just fuel for our body. Food is also culture, right? Food is also satiety. What do we do when we invite people into our homes? Would you like something to eat or drink, right? So we need to be very mindful of who this person is that I'm talking to about their diabetes, and not just say, well, this is the amount of carbohydrates you can have, and this is the amount of fats that you should have, and et cetera, because when we look at someone's adherence to diet, rest, and activity with their diabetes, we have to measure in their culture and who they are to make a balanced approach.
It's exciting to be thinking about such an integrated care approach at a behavioral health organization. What we know is integrated care produces better outcomes for the people we care for, reduced healthcare costs, and better outcomes. When I think about myself as a behavioral health professional, I can offer some tips that we can all consider. Ask the folks you're working with, do you have diabetes? How are you managing it? Does it feel stable? Do you have the right healthcare support for that? Be helping to advise, sharing some of this information about, validating the high correlation between mood disorders and diabetes, validating the effects of blood sugar on mood, and then referring to the right, and linking folks to the right resources. So we want to be thinking about primary care linkage, evidence-based behavioral health and substance abuse treatments, and wellness supports.
Yeah, and we have great wellness groups here at CHR. Our new R group is a great place for somebody that's diabetic to get some support and some information. And when I'm talking with somebody about their diabetes or a number of chronic diseases, I always start with, tell me what you know about ... your diabetes, your emphysema, right? So we can start the conversation from where the individual is at and their learning and their cognition and their understanding.
That's a great tip. Can you explain a little bit what a diabetic crisis might look like? Sure.
And we see those here at CHR, unfortunately. So it can be one of two things. It can be a very, very high blood sugar, right, where there's too much sugar in the circulating blood in our body and not enough getting into our tissues. Or it can be a very low blood sugar where the insulin or the medicine that they've taken wasn't balanced out with enough food or whatever, right? So, but we'll see kind of the same thing. When it's an emergency, we'll see lower cognition, we'll see higher degrees of confusion, right? We'll see behavior that doesn't look right. It's a client and they're generally on time, and they're generally, neat in their appearance, and they come in and they're disheveled and they're a little late and they seem a little disorganized. Those should be tips that maybe there might be something up with their diabetes and their management of their diabetes right in the moment. Because what we know is the more sugar we carry in our bloodstream, the less other things that we can carry in our bloodstream, like oxygen, other nutrients, and carrying away waste, right? So that can affect our brains as well, right? Not just muscles. And I think that, that's the time that you want to reach out and look for some help managing, right? The patient may actually seem drunk too on some occasions.
Yeah, it's good to be aware of, right? Because it can mimic a behavioral health crisis or substance abuse, relapse. And so it's good to be aware of the interplay between mental health and diabetes.
Absolutely. A careful, thoughtful approach and reaching out for help where you need it.
Sounds good.